It might look like a science fiction movie, but this is the reality of battling the worst ever outbreak of the world's most virulent disease. This is a rare glimpse inside an Ebola clinic in Conakry, Guinea. Inside the high-risk zone, patients who have the virus face a grim, solitary struggle to survive. Some endure horrific bleeding, nursed by doctors whose faces they can't see. But there is hope. Mabalia is fighting off the virus. She still doesn't want us to show her face because of the stigma of the disease. This is as close as the doctors will allow me to get to someone who's still infected with Ebola. She tells me she's a traditional healer who caught Ebola trying to treat others. She says she feels better now and urges others with symptoms to go to hospital immediately. The staff treating her and the 3 other patients here are doused in chlorine each time they leave. And their gloves and suits are incinerated. Just one drop of infected blood, sweat, urine or feces could be a death sentence. Nurse Monia Sayer tries to reassure patients inside, who've included children and even a 7-month-old baby who died.
We try to be there and to be as present as possible and touch them and comfort them. And this is quite difficult, yes.
When the outbreak began in March, the virus killed up to 90% of those infected. Now, at this clinic, that mortality rate has fallen to 37%.
C'est bon?
I can't go into the high-risk zone, but one of the doctors suits me up to get an idea what it's like in this stifling climate.
The doctors and nurses have to perform their daily duties in these biohazard suits, and they are absolutely sweltering. One doctor recorded a temperature in the suit of 46 degrees centigrade, and what they're witnessing inside the high-risk zone is often incredibly harrowing.
Dr. Ibrahim Bey says, "I was shocked when I first went in because there was a patient who was writhing in his own blood on the floor. It was really incredibly difficult." Medecins Sans Frontieres says this outbreak is out of control in West Africa. For Conakry, a city of 2 million people, many living in appalling squalor, that's clearly worrying. But the doctors insist Ebola can be beaten if people's hysteria is replaced with knowledge and action.